this segment of talking about herbal first aid, I want to discuss some of the different preparations that herbalists use to treat people and some very basic general rules about dosage. When I cover specific herbs, we're going to discuss specific dosages per herb. There are, so there's some vague generalities, and then we'll talk about specifics when we get to the specific plants and specific times to use them. In first aid, the main form of herbal medicine that I use, and I would say most people use, is going to be tinctures. When I use the word tincture in this class and in general, by tincture I mean alcohol-prepared medicine. Sometimes people talk about vegetable glycerins being a kind of tincture. They'll say a tincture in vegetable glycerin or a tincture in some other fluid, menstruum. But for me, when I use the word tincture, I mean a plant prepared in an alcohol menstruum. Menstruum is just a word that you use to prepare something. Like if you make a honey, honey is your menstruum. If you make a liniment, isopropyl alcohol is your menstruum. So tinctures are by far the most common form of medicine, preparation to use for first aid. The reason for it is they're easy to carry, they last a pretty long time, and they're pretty concentrated. And all those are really helpful when it comes to first aid. So let me give you something, a kind of medicine that I like to use in the free clinic, one of the most common kinds of medicines that I use, but not in first aid, and that is tea. So I've switched from tinctures to teas for a minute just to give a comparison. So a tea is basically preparing plants in water. And that's the trick, is the preparation. So I like to use teas, and we're going to talk about washes and soaks. But the problem with them is they don't last. When you put plants in water, you only have a few days at best before bacteria start to grow in it, and it's also just a lot of work. So at one point, the cameras will be pointing to different tinctures, and so you have a sense of what they look like, which is just really fluids in bottles. But while I like teas in general, in first aid they're difficult to make and they don't last very long. While tinctures, you can easily transport them, they don't go bad fast, and they're concentrated medicines. There is one big disadvantage to tinctures, on top of all the others, and this is going to become important because every time you're going to administer a tincture, I just mean giving it to anybody, before anybody gets a tincture, you have to ask them one important question. And that question is, do you have any difficulty with alcohol? So, difficulty with alcohol is kind of code, I guess, for alcoholic. But the word alcoholic doesn't mean, what it means is kind of a specific thing. But really what I just want to know is, can this person drink alcohol or can they not? So for many people, alcohol is their biggest problem. Drinking is the thing that will cost them the most life energy. They're going to drink, they might not be able to stop drinking. So before I give anybody a tincture, so I have my bottle, and what I'll say to them, because you can assume that they don't know what's in that bottle, is I'm going to ask them, do you have any difficulty with alcohol? The majority of the time, people will say, actually, I love alcohol. So that means you can give them alcohol. Then some people will say, well, actually, I don't drink. Sometimes they don't drink for religious or other similar reasons, but then if that's all you have, that's up to them. That's one, if they don't drink alcohol because it's against a kind of a principle, that's reasonable, but that's not my biggest consideration, honestly. My biggest consideration is for people that when they drink, they can't stop drinking. And I want to be extremely clear that for some people, tiny amounts of alcohol will give them that alcohol effect that they love so much and can start them drinking. And my fear is to start people drinking who have stopped drinking. So I'll hold up a bottle of the tincture and I'll say to folks, this is a tincture and it has alcohol in it. Is that a problem for you? That's the easiest way to say it. Just something, you just have to say, point and say alcohol. For those people that alcohol is a problem for, they will know immediately what you're saying because they live with problems with alcohol. And what they might say is, I can't take any alcohol at all. In which case, no tinctures. There's no tinctures. You don't put it in hot water because even small amounts could start the person drinking, which is probably worse than whatever problem they have coming in. Now, a large amount of people will say, I don't drink anymore, but actually tinctures are fine for me. So in that situation, you can give them the tincture or the alcohol-prepared medicine, but you're looking for that small percentage of people that can't drink at all, and alcohol is one of their biggest health risks in their life. So I hope that makes sense, and I hope you just get in the habit of asking anybody that you don't know, like, this has alcohol, is that a problem for you? What normally happens, by the way, is the person takes almost a step back. It's that classic cross to the vampire thing, which is, I'll say this has alcohol, and the person like steps back because they know, they know that that's not going to be good for them in their body. So, say it again. Be careful about giving people alcohol that don't drink alcohol. Just allow them to know what's in that medicine. So, but the problem with this is that the majority of things I use aren't alcohol. That's why I said that whole thing about if they have principles against it, they have to make a decision. So if the person can't drink, I might not have many medicines available for them, depending on what their situation is. Most of my medicines are in alcohol because of all the reasons I said before: stability, transportability, those kinds of things. There's a few other kinds of medicines I carry with me. I have a few things in vegetable glycerin. And vegetable glycerin, while technically an alcohol, doesn't have any of the effects of alcohol. But I find it's not nearly as strong a medicine. And as I'll mention later, like when I make medicines, I want them to be strong so I can carry the minimum amount. I want potent medicine so I don't have to have as much of it on me at any one time. And vegetable glycerins aren't as strong, but I usually have one or two things in vegetable glycerin for people who can't drink alcohol at all. I have things in oils and salves. So these are topical applications, meaning that you put them on the outside of people's bodies. An oil, what I mean in oil here, I mean what's called an infused oil. So I take a plant, let's say arnica flowers, and I put the arnica flowers, and you have to learn how to prepare oils, and I cover them in what's called a fixed oil, something like extra virgin olive oil. So that's different as opposed to an essential oil. So I have fixed oils with me, which was a plant that I've infused, kept in some kind of carrier or fixed oil, such as extra virgin olive oil. So an arnica oil with flowers in an outside oil. That's, by the way, different than if I took arnica and I had enough of them and squished it and got the oil out of them. That would be a whole other kind of oil. This is an infused oil where the plant has been sitting in the oil for a while. So I use oils for topical applications. I also use salves, and a salve is when you take the oil and you add in beeswax, and then it solidifies it. It's just an easier preparation sometimes to use salves. They're a little less messy, and as long as they don't get too hot, we'll talk about hot and cars later. They're just a nice, easy preparation to carry around, especially things like lip salves, but you can use them all over, just like you can with oils. So oils and salves are topical, meaning external applications. Another form of medicine I use is what's called a liniment. A liniment is a plant in isopropyl alcohol. That's a petroleum-based alcohol generally. So they're not for internal use, the isopropyl alcohols, but they're really inexpensive, and they are good external applications. This is a classic when you try to bring down somebody's fever and you give them rubbing alcohol. Rubbing alcohol is isopropyl alcohol in water. So you can also put plants in that, like arnica once again, because liniments, the isopropyl alcohol gets in deeper. So you don't want to use too much of it because they absorb it, but it's an inexpensive way to get medicines deeper in than oils will, get them to evaporate quicker off them too. So that's a liniment. I also use a few essential oils. And essential oils, when you take the plant and you throw it through some kind of process where you extract the oil from that plant, as opposed to an infused oil where you take the plant and put it in oil and extract it in that outside oil. An essential oil is something like peppermint, where you put peppermint, you get a lot of peppermint, and you put it through some process and you scrunch it and get the oil out of it, and then that oil is called a volatile or essential oil, and I use a few of those as well. So those are the main preparations, as you'll see when you go through the first aid bag. One more preparation is a form of tea for external uses, and it's called a soak or a wash. A soak or a wash is when you make a really strong tea with a plant like, usually a strongly anti-infective plant, like yarrow, Achillea millefolium, or chaparral, Larea, where you make a strong tea and you soak a body part in it that has an infection. So we'll be covering those later, but those are soaks and washes. When I talk about external infectious diseases, I commonly employ both of those things. Soaks, they're really the same thing, a soak and a wash. The other thing that's similar is what's called a compress. If somebody hurts a part of their body and you make a soak, so if, let's say somebody twists their elbow and you want to wrap the elbow in something that will help with inflammation, you can make a soak or a wash with something like ginger tea, which is an anti-inflammatory. And then you take a cloth and you stick it in the ginger tea, and then you wrap that around the body, and that's called a compress. So now we have soaks and washes where you put the body part in to soak them. You could put that elbow in the ginger tea, and it wouldn't be a compress, it would be a soak. If you put the cloth in the tea and you wrap it around them, it's now called a compress. Slightly different than a compress is a poultice. And a poultice is when you take a plant and you crush it up and you put it directly on the body part. So what I've just described is a soak and a wash and a compress, and now a poultice is the last one. I want to put them in order. So a soak, or you injured your elbow and you stuck your elbow in some strong ginger tea, that's a soak. A compress is I had a strong ginger tea and I put a cloth in it and I wrapped the cloth around me, around the elbow, that's a compress. If I took the ginger and I mashed it up and grated it or cooked it and smashed it down and I put the ginger directly on the elbow, that's called a poultice. I don't use a lot of them. They're very messy and they're not that easy to work with in the field, but just giving you the differences between poultices, compresses, and washes. So once again, soak is when you put the body part in it. A compress is when you take a cloth from the tea and you put it on the part of the body needing it. And then a poultice is when you actually take the plant and crush it and put it on. So those are some of the main forms that I use. But once again, really, I use the majority of stuff is clearly tinctures. They're just the easiest to use in a lot of first aid circumstances. What I want to show now is how I test tinctures in people's bodies in acute situations looking for responses. Ready for this? So we're just going to use an example, and Mario will be my model here. And let's say Mario has a really bad headache. So when I meet somebody, I tend to shake their hand. I'm not much of a hugger, especially in the world of licensed scabies. So Mario, I think, has neither. And I usually do something like this. 7 song.
Mario.
Hey, Mario.
Hello.
So I know that it seems simple, and then looking at it, things, you know, like why have that in there? But I'm telling you that situation, I'm going to do it again, which is when you come up to somebody and you introduce yourself and you give like a bit of confidence and I'm present, it helps people. So, and also, so 7 song.
Mario.
Hey, Mario. So a little bit of eye contact and kind of staying with them a minute. Like it doesn't have to be a crazy, like who wins handshake. It's just a matter of saying that, it's a matter of asserting presence really when you do these kinds of things. Also, it allows confidence and I now know his name. And so in this situation, Mario's healthy and so he's easily giving it to me. But when you know people's names, it's very important because sometimes if people are in a lot of pain and you need to kind of drag them out of the pain to answer questions, it is their name that will help. So if Mario is in a lot of pain and with a lot of diarrhea, let's say, he's had some kind of digestive disorder, and then later on, I can't find him anymore, I'm looking for him, I could just say, Mario, you know, and just start calling his name. Or if he's just like in a lot of pain, I can go down and say, Mario, I'm here. And giving people's names back to them often helps people feel better. It's just true. People like to hear their names, and so you should learn to get people's names and to use their names. People often say that names are power. I'm not sure about in a whole religious, spiritual sense, but there is something about hearing your name and trying to resist it, like walking away while somebody's calling your name. You know how difficult that can often be. So back to the tincture. So Mario's come in, I already know he has a headache, and I want to try different medicines to see if I can help his headache. What's important here with doing this is that Herbs act idiosyncratically, meaning different for each person, especially in acute situations. So when people are in pain, one person's remedy might make another person's pain worse. And so what I want to do is test small amounts. So what I'm going to show you is what I call the one drop dosage. And the one drop dosage is what I start with when people are having an acute flare-up of a problem, often pain or allergy, something with symptoms that are kind of at a heightened state, to see if I can absolve the symptoms a little bit. I don't do this with chronic healthcare problems. So if somebody comes in and says, I have Lyme, I don't test medicines to see if I can help the Lyme because I can't see if there's any change. But if Mario comes in with a really bad headache and I give him some medicine, if the medicine makes him worse, I'll be able to see that. I'm going to show you how I would do this. If the medicine doesn't do anything, I can see that. And if the medicine makes him better, I can often see that. And I'm going to start with small doses. So that way, if the medicine makes him worse, there's a very small amount in there, and I can switch it to another medicine. So what will usually happen is Mario has a headache, and he's come in to see me. And sometimes I'll show Mario the bottle, but honestly, a lot of people don't really know what I'm giving them and are not that interested. But if they ask, of course, I will tell them what I'm giving them. So, Mario, what I'm going to do is give you some of this tincture. Mario, being an herb guy, is probably going to say something like, what is that? I'll go lobelia. So I've just told him it is lobelia. I do use lobelia for some headaches. And then what I'm going to say next to Mario, or whoever I'm working with, is I want to try one drop of this in you, and I want you to tell me if it makes you feel better or worse. Okay. Now, before I give him anything, this is for you folks back home, before I give him any tincture, what am I going to ask him first? You have 5 seconds. You're going to ask him, do you have any difficulty with alcohol? You can also ask other things. You can ask people, do they have any long-term diseases like diabetes or something? But really, right now, the important thing is don't give anybody alcohol that doesn't want alcohol in their body. So I've asked Mario, he doesn't have any problem with alcohol. And what I'm going to do now is I'm going to give him one drop. I'm going to be the one to administer it. So I'm going to hold the bottle, or I might put it down. And you don't have to, some people often just make sure there's only one drop. The bottle could be full. You just have to learn how to do one drop. And by one drop, I mean one drop, one goot, as they say. So I'm going to say to Mario, I'm going to give you one drop of this, and I want you to tell me if it makes you feel better or worse, or is there no change at all. Mario or whoever will often ask, really, you can tell with one drop? And I'm telling you that often you can tell. So what I'm going to do is open up. So this is good. So Mario is going to keep his head like this. So what I'm going to have to do is tilt it back a little bit, come in slowly. People often open their mouth and face. You can close your mouth, Mario. People could often open their mouth straight at you, but you can't really get medicine in them when that happens. So do it the same way. So I just generally tilt their head up a little bit. And then I'm going to give Mario one drop. And then this is not going to be so good because Mario has tasted many nasty tasting things. So you can sit down, Mario, thanks. So I will demonstrate usually what you see. When you give somebody one drop, usually, especially something nasty tasting like lobelia, I just want to say that almost everything I have here is pretty disgusting flavored. Including even things like peppermint tincture. To a person who's never had peppermint tincture does not taste like lifesavers. So you give them one drop, and often what the first thing they do is they make a face because of the revolting flavors of most of the medicines that I give them, all the tinctures basically. So I give them one drop, and often you see you get a scrunchy face and maybe a little bit of tightness. Remember, Mario has a headache here, but ignore that. It's the second set of effects that you're looking for, and you commonly see them. Just practice, and you'll see this often. So it's only on one drop. So there's three possible scenarios. Of course, there's hundreds, but the three most common scenarios. The first one, there's no real order. The first one is the person, so they had a headache. This is just one instance. The person has a headache. You give them a drop, and they do something like this. They basically tighten their face a little bit. And they have like a that made me feel worse face on. Most of us know that made me feel worse face. So they do that made me feel worse face. And then I'll still ask, I'll say, Mario, did this medicine make your headache better or worse? At this point, this is a little tricky because sometimes I could see that it's made Mario worse. I'm watching Mario and it looks like his headache's worse. I mean, people tend to tighten things up when they have pain. And he's like, oh, I'm not really sure. But everything around him says worse. So I might say gently, it looks like it might have made you a little worse. And then if he feels like that's true, he goes, yeah, it did. Because people don't often want to say, like, you just made them a little worse. It's just a part of, some humans are happy to say it. But many people will be reserved. So you want to say to them, it looks like it made you a little worse. Because it can. Of course, you're going to make people worse if you give medicine enough, right? So Mario might say, yeah, maybe a little bit worse. So then I could say to him, I'd like to try something else. Are you interested in that? Sometimes people aren't, right? Because you've just made their headache worse. But sometimes people are like, yeah, okay, I've had this headache for a day and a half now. So then I could try something else. I've only given him 1 drop. So that the next medicine, it's like there's not that much lobelia or whatever medicine I gave him in his body. So that's scenario number 1. So generally when you make people worse, they tighten up. They scrunch their face a bit and they tend to tighten their shoulders. And really, they just look like you've increased the pain. Whether it's shoulder, I might be giving black cohosh for lower back pain. I might be giving ragweed tincture for allergies. If you've made their symptoms worse, often the person looks like you've made them a little worse, but usually it's a bit of tightness. So scenario number 2, I give Mario a drop of lobelia, and he takes a breath, sighs a little bit, and relaxes his body. And it becomes pretty apparent to anybody watching that he feels a tiny bit better. The same thing is true. Often people can't believe that a drop of something will have made them feel better. So in this scenario, I give Mario a drop and he goes, first he makes scrunchy, tasting flavored thing. Then he relaxes. And then he takes a breath and he looks a little bit better. Usually when people feel better from symptoms, they become untight. And then I'll say to Mario, whoever, it looks to me like you feel a little bit better. Or no, so I'm sorry. So I might ask him first, how do you feel? And he goes, well, I'm not really sure. And then I might say, it looks like you might feel a little bit better. This is a leading question, so you have to be careful with leading questions, but it looks like he is. Or you could say just like, do you feel any better at all? Like a non-leading question. Does feeling a little bit better? Usually if he is, he's going to say, yeah, actually I feel a little bit better. That's weird. I just took 1 drop of that and I've had this headache for a day and a half. In this scenario, you might give them more. If the headache is still there, you can increase the dosage until you see if you can resolve the symptoms of the headache. So that's scenario number 2. They feel better, they feel more relaxed, and the symptom is less obvious. Scenario number 3 is neutral. So Mario came in with a headache. I give him some medicine. He makes a scrunchy face because it tastes bad, and then he looks kind of exactly the same. Then I might ask, do you feel any difference? He's like, I'm not sure. I'm like, do you feel a little worse? Do you feel a little better? Giving him the options. It's like, I don't feel any different. At that point, you have to make a decision whether you want to give more of the same medicine, because sometimes you just need more, or you might want to use a different medicine and attempt it. So basically, that's the way that I approach trying to help resolve symptoms with 1 drop or a couple of drops of different tinctures. I suggest giving it a try. I don't do any muscle testing, of like applied kinesiology or any of that. I just, it's not where I put my faith in as far as testing it. But I do it in this situation where I give the person a drop, I watch the reaction, and I take it from there. So that's the 1 drop dosage.